Hi, everybody. This is Dr. Wright. I'm talking today about tumescent versus general anesthesia. So first, I want to explain what is tumescent anesthesia. So tumescent anesthesia is when dilute local anesthetic, usually lidocaine, it is with added epinephrine. So the epinephrine decreases the risk of bruising and blood loss, and then the local anesthetic provides the anesthesia. This is what it looks like. So the tumescent means swollen, and so the mixture is infiltrated into the skin swells and becomes tumescent or hardens, and then we go. So where did this tumescent technique originate? So it was developed by a dermatologist, Dr. Jeffrey Klein. And really, this is the start of modern liposuction. Prior to tumescent technique, dry liposuction was done, which was associated with significant blood loss, bruising, and skin irregularities. So this really, this was developed by Dr. Klein in the 80s, and then over the next decade or so, the popularity and acceptance of liposuction really took off. I was fortunate enough to train with Dr. Klein, so we'll talk a little more about that later. So what is general anesthesia? General anesthesia is a combination of intravenous medications and inhaled gases that produce unconsciousness. There are some risks with general anesthesia. The risk of death is 4 in 100,000. That has come down. 50 years ago, the risk was higher, but actually, recently that risk, the rate actually may be going up again as patients are older and have more comorbidities. So general anesthesia can cause an anaphylactoid reaction, which is very serious, and also another complication called malignant hyperthermia. These are really only occur with general anesthesia and can be quite serious. Older patients are particularly sensitive to general anesthesia, with some studies showing increased memory problems and cognitive decline in older patients who undergo general anesthesia. So let's go through the pros and cons of general anesthesia. It produces unconsciousness, which can be beneficial for anxious people. It has patients do not feel pain or discomfort during the surgery. And for complicated surgeries like heart, lung, bowel surgeries, general anesthesia is generally preferred. It does have a longer recovery time. There's an additional recovery time just from the general anesthesia. It doesn't assist with post-procedural pain like tumescent does, and it is associated with more complications, as I already explained. Now, tumescent anesthesia is performed with lidocaine, has some antimicrobial or antibiotic effects, which lowers the risk of infection. The infection risk is very low with tumescent anesthesia. Some surgeons substitute a wetting solution with epinephrine, or maybe kind of try to do something like their tumescent like, but it really does not have the same protection against infection or post-operative pain, or really many of the benefits that true tumescent has. Generous tumescent also works to protect lymphatic structures, and that was demonstrated by Baumeister and Frick. And it has good to excellent pain control if done properly. And talk a little more about proper. So to work best, it needs the tumescent solution needs to sit in the tissue for a half hour to 1.5 hours, and this allows the tissue to gel, and also the full effect of the pain control. Many surgeons use tumescent, but they rush through it. They don't do it properly. And these are all, when they're also using general anesthesia, and they want to stick to very short surgery times, and they don't get as good a tumescent effect, or sometimes then they don't believe in don't realize all the benefits of tumescent anesthesia. So in conclusion, for simple outpatient surgeries, tumescent anesthesia is associated with lower infection risk, quicker recovery, less postoperative pain, and lower risk of complications, and really is probably the preferred type of anesthesia for simple outpatient cosmetic procedure like liposuction. Thank you very much for your time. I appreciate your attention. If you have any questions, please feel free to put them in the comments, and you can like and subscribe. And I'm planning to do more of these talks. So, thank you.